Hello. My name is Jones, and today we are going to look at mental health nursing skills. We are going to look at mental health nursing skills in 3 dimensions. Okay, so it is important we appreciate this lesson because we are going to learn about the nursing skills that we can use in these 3 dimensions that we are about to discuss. Okay, so we have stress management. Under stress management, we are going to look at the relaxation technique. We'll look at mindfulness practices. We're also going to look at time management. We will also appreciate resilience building activities. And also, we are going to look at coping strategies. So, this is under the first dimension where we are appreciating stress management. Let us look deep into stress management. So when we say stress management, we are looking at the ability to recognize, understand, and handle stress effectively to maintain emotional and physical health. Remember, by WHO definition of health, the dimensions of health include the social well-being, the physical well-being, and also the emotional well-being. So when we're looking at stress management, we want an individual to have the ability to recognize, understand, and handle stress effectively so that they can maintain emotional and physical health. This is vital for mental health because chronic stress can lead to different conditions. Some conditions can be physical, some conditions can be psychological. So some conditions that can come because of chronic stress may include anxiety, which is discussed in mental health. It may include depression and also may include physical illnesses. A lot of physical illnesses, may come because of poor stress management. So it is important that as a mental health practitioner, you know how to manage stress. So some stress management skills here includes relaxation technique. So with this relaxation technique, what it just involves is deep breathing exercises. Deep breathing exercises ensures that you have a lot of oxygen to your muscle, which will reduce the stress on the muscles. It will also ensure that you have a lot of oxygen to your brain, which will reduce the stress within the brain cells. Remember, some may have a headache because of a lot of stress, and this may come because of lack of oxygen supply. So other relaxation technique can also include a progressive muscle relaxation. This is to reduce oxygen consumption, hence helping the muscles to relax. Meditation, one of those things that in African culture where we don't see it that much may be underrated. So meditation helps for the mind to be refocused. It helps for one to take up oxygen enough during this time when they are meditating. So meditation is a powerful tool or a powerful therapy in helping to reduce stress. Another one which has become popular is yoga. Yoga helps to calm the mind and also reduce physiological stress responses. So, talking about relaxation technique for a patient with a stress-related condition can help them to recover from their condition. So we now look at mindfulness practices. So being present and fully engaged in the moment without judgment helps an individual reduce anxiety and improve focus. Hence, mindfulness is about you as a therapist being involved or being engaged as you nurse the patient with a stress-related condition. So as you do this, you should be non-judgmental so that you can help the patient with the anxieties that they may have. In this way, you're going to rule out or help the patient with or cope up with the anxiety levels. So mindfulness-based stress reduction is also a widely used technique in mental health and helps to reduce stress-related conditions. Then another one that we can also appreciate is time management. Prioritizing tasks and avoiding procrastination can reduce the feeling of being overwhelmed. A lot of people find themselves stressed because of poor time management. Time is money, so we say. So, for you to manage time, you need to have a to-do list. When you have a to-do list, it will help you to reduce on stress because you are going to put those things that are of priority that you are supposed to do. You can have a planner activity. A planner activity will help you to have activities from the highest of priority to that which is of less priority. So have a planner card or planner activities. Then you can also use the Pomodoro technique, which can also help you have activities in a way that your brain or your body can tolerate. So Pomodoro technique can also be used as a time management tool. Then we have a resilience building activity, two in stress management. Resilience building activities. So this involves engaging in hobbies, physical exercise, and positive social interaction. When you are involved in hobbies, physical exercise, and positive social interaction, it will enhance your capacity to cope with stress. So when you are stressed, we're saying take up a hobby. When you are stressed, we're saying do a little bit of physical exercises or engage in some positive social interaction. This will reduce the stress levels, hence avoiding the conditions that may come because of too much stress. Let us now look at coping strategies in stress management. Coping strategies here, we are looking at learning to refrain from the challenges, or learning to refrain challenges positively and seeking support from others so that they can help mitigate the impact of the stress. Coping strategies, you may have coping level 1, coping level 2, coping level 3, and maybe up to level 4 as the way you cope with the challenges that may bring stress. So, as you cope with the stress levels, there are some times you might have to use the knowledge that you have. There are some times that you might have to seek for advice. There are some times that you might need an expert's opinion. So, coping strategies is going to help in stress management. So with that said about stress management, let us now look at the other dimension, which is behavior modification. Under behavior modification, we are going to appreciate these items: positive reinforcement, negative reinforcement, cognitive restructuring, habit reversal training, and behavioral contracts. So let us first now understand what behavior modification is before we go to positive reinforcement, negative reinforcement, and others that we can appreciate under behavior modification. So behavior modification is the process of changing specific behaviors to improve mental health and well-being. It is based on the principle of operant and classical conditioning. This approach is effective for addressing unhealthy habits. Okay, in mental health, you learn about normal and abnormal behavior. Abnormal behavior are unhealthy habits. Okay, so when you're looking at behavioral therapy, okay, it is also effective in addressing or improving social skills and also overcoming fears or phobia. Behavior modification, a process of changing specific behavior to improve mental health and well-being. Okay, so what are some of the things that we are going to tackle in order to bring about behavior modification? So there is positive reinforcement technique or positive reinforcement therapy that we are going to apply. So when you're talking about positive reinforcement here, we're looking at encouraging desired behaviors by providing rewards or praise for each and every desired behavior. The example here that we can appreciate is that of rewarding someone after a completion of a challenging task. Here, the someone that I'm mentioning is the client that is facing these challenges. Then we have negative reinforcement. This involves reducing or eliminating unpleasant stimuli when a desired behavior has been attained. For instance, removing restrictions after compliance with therapy goals. We don't punish in mental health therapy, so you apply negative reinforcement, where you reduce or eliminate the unpleasant stimuli when a desired behavior has occurred. Okay, then we have cognitive restructuring, which is also a technique or tool under behavior modification. This involves identifying and challenging negative thought patterns that influence behavior. This will help in developing healthier attitudes and responses. Cognitive restructuring, we identify some negative thoughts, patterns that are influencing the client's behavior, and we try to reshape the patient's behavior so that we can have healthy responses. Then we have habit reversal training. This is used for conditions like tics, nail biting, or compulsive behaviors, focusing on replacing the undesirable behavior with an alternative action. So in habit reversal training, we want to replace the undesirable behavior with an alternative action. And we see this in patients with compulsive behaviors. You can also do behavior contracts in behavior modification. So behavior contracts involves having an agreement with the client. You as the therapist, you have an agreement with the client where you outline specific behavior changes and the consequences for achieving or failing to meet the goals. Okay, so we're looking at behavior modification, and we have looked at behavior contracts as the last item under behavior modification. So the next or third dimension that we need to appreciate is that of psychotherapeutic skills. Under psychotherapeutic skills, we are going to discuss active listening, empathy, and establishing a rapport, or having a nurse-patient relationship. Okay, so what do we mean when we say psychotherapeutic skills? This involves a broad range of therapeutic techniques and interpersonal abilities that facilitates emotional healing, personal growth, and improved mental health outcomes. These skills are fundamental for counselors, psychologists, and mental health professionals. So, psychotherapeutic therapy is important for each and every patient with the mental illness. Okay, so active listening under psychotherapeutic skills. Here we are trying to appreciate the full concentration on what the client says, what the client wants. Okay, we understand their perspective and respond thoughtfully. This will help to build trust and validate clients' feeling. Active listening, it involves full concentration on what the client says that he wants. We understand their perspective and also respond thoughtfully. Okay? As this will help to build trust and validate the client's feelings. Then we have empathy. Under psychotherapeutic skills, we have empathy. So empathy here is understanding and sharing the feelings of others without judgment. So empathy is going to help to foster a supportive environment for the clients so that they can open up. Okay, so apart from empathy, then there is having a nurse-patient or a healthcare patient relationship. So this involves building a strong, trusting relationship with the clients that is essential for successful therapy. It's more like having a therapeutic relationship with the patient. So it can include being respectful. Okay, you act in a warm manner and you act in an approachable manner to the patient so that the patient can come out. Okay, so establish a rapport. Rapport building with the patient can help, okay, so to build trust with the patient. Okay, so those were the 3 dimensions that we need to appreciate as we nurse patients with mental illness. Okay, so I'm going just to add a little bit on evidence-based therapy approaches. So on evidence-based therapy approaches, I can also talk about cognitive behavioral therapy as one useful tool in nursing patients with mental illness. It focuses on identifying and changing distorted thinking patterns and behaviors. So, cognitive behavioral therapy, you are changing cognition, okay, perspective of the patient, and this is manifested in the patient's behavior. So, cognitive behavioral therapy, which will focus on identifying and changing the distorted thinking patterns and behavior of the patient. Then we have psychoanalysis. This explores unconscious thoughts and past experiences to understand present behaviors and emotions. When you're looking at psychoanalysis, we are interested in what is happening in the unconscious realm, unconscious thought of the patient, the things that might have happened in the past, so that we understand the present, and then we can try to help the patient. Then there's a solution-based brief therapy. This emphasizes setting goals and finding solutions rather than dwelling on the problem. Okay, solution-focused brief therapy. We are looking at setting goals and finding solutions. Okay, rather than just looking at the problem. Okay, then there is also crisis intervention. This involves managing an acute psychological crisis such as suicidal ideation, trauma, or severe anxiety. So this will require specialized skills to stabilize and support an individual. Crisis intervention. When do we do crisis intervention? In mental health emergencies. Okay, because we have a psychological crisis. So Who are some of the patients that may come and need crisis intervention? Suicidal patients or patients with severe anxiety. All patients with mental illness may require some education, and for the purpose of this, we are going to call it psychoeducation. So, teaching clients about mental health conditions, coping strategies, and self-care practice can help them to be empowered so that they do not engage in some things that are or may be considered to be taboo or that are mentally unhealthy. So, psychoeducation is important for our clients' mental health. Okay, so to sum up, what we have been looking at are 3 aspects that can be used in nursing a patient with mental illness, and that is stress management, behavior modification, and psychotherapeutic skills. We have talked about these 3 aspects because they are interrelated and crucial for maintaining mental health. Okay, they are not only, or they are not going just to help the individual with mental illness, but they will also help you as a practitioner to help the patient recover and cope with the challenges that they may have that is bringing about abnormal mental well-being. So when you master these skills, they can lead to a more balanced and fulfilling service to humanity or service to patients with mental illness, and also will lead to a fulfilling life to the patient that may be suffering from the condition. So from me, I'm saying thank you and keep studying.